Hi, welcome to another edition of Your Health Matters with Dr. Benjamin Bryant, Chief of Staff and Chief Surgeon for UH Conneaut Medical Center. We're doing something a little bit different today. Over the last several weeks and months, we've gotten questions that, since we don't have the opportunity to answer live phone calls in this particular show, we have taken the questions and promised that we would get back to our viewers out there on what's happening. Doc said he would answer these questions. So we've got several questions that we're going to start to address here. You might not get through all of them, but we will, Doc, do it again, another show.
First of all, I'd like to thank Pat for doing this. Pat was the one who got, the questions were sent to Pat, and he passed them on to me. And I really appreciate him taking the time and trouble to do that. And absolutely right, Pat, there were a lot of questions, and we're going to go through them and answer them. And there were so many that we may not get through them all on this segment, but we will definitely finish them up on a follow-up. And I do encourage all of our viewers to contact Pat or myself with any questions that you want to have addressed, because that's what this show is about, and we want to do that. And I'm also going to tell you again, I'm going to mention this on every segment, all of these programs are available on YouTube. All of them are available on YouTube. You can go, all you have to do is go up to YouTube, and in the search bar put Your Health Matters and then my last name, Your Health Matters, and then Bryant, and you'll see a show pop up, and then you can go to the channel that has them all and subscribe to it, so you can go back and if you miss something or want to hear it again or what have you, or somebody else says, gosh, I'd like to know about that, all of those shows are up there. So you can go ahead. There's like a library. So
I did that last week after you told me about that, and it works.
It worked.
Yeah.
Great.
So this is kind of something that Doc and I did for like 7.5, almost 8 years,
Yeah.
where we'd sit down and just talk about your health, and on the AM Live show, and we haven't really done this format for a long time. So Doc, we're back, I guess.
We're back. We're back. Yeah.
All right, let's start out with some of these questions so we can get through some of them today anyway.
Okay.
This was one of the first questions that come in the last month. Should Conneaut residents be concerned about the Zika virus here? And also, should people be concerned and avoid mosquito bites for any other reason while sitting outside during these summer months?
Well, I mean, other than the fact that mosquitoes are obnoxious.
Hate them.
Well, I'll tell you what, disease or no disease, if they're thick and you go outside to enjoy the evening, they can ruin your evening in a heartbeat. So, But as far as being worried about Zika virus, the short answer to that question is no. N-O, okay? As of July 13th, the Center for Disease Control, CDC, has indicated that in terms of a mosquito biting somebody and giving them Zika here in the United States, 0 reported cases. No cases. People in the United States have contracted the Zika virus, and that was through travel to areas where it is. In the U.S. territories, the most cases have been reported in Puerto Rico. Okay, so it is definitely down there. But no transmission by a mosquito in the United States. Now, it's emerging that you can catch it from somebody else, but not from a mosquito.
Okay.
So there's very, very few cases. There's very few cases in the United States so far, and none from a mosquito bite.
And so it would be safe to say also that, other than being annoyed by them, which I hate them when you're sitting out and they're getting bit up, you should be okay.
Absolutely.
You just want to probably go in the house and get out of it.
Yeah, or use some repellent or
Yeah.
what have you. Now, there have been 14 cases that were in the United States from sexual transmission and there were 1,300 cases in the United States from travel. So they're all from those ways, not from the mosquitoes.
Okay, there's the answer to that. Dr. Kumar talked about sunburn recently, a very good segment that was very timely for this time of year. But one of our viewers out there want to know about suntanning booths, and are they equally as dangerous as exposing yourself to the normal sun?
The answer to that one is yes, they are. The way that works, it's the ultraviolet radiation that damages the DNA in the cells of the skin. That radiation, that's high-powered stuff, it's of a certain frequency, and it interacts with the DNA and sort of breaks it, sort of breaks the DNA. Now, we have enzyme systems in our body. It's amazing, actually. We have enzyme systems in our body that will recognize that and repair it. And usually that goes the way that it's supposed to go. But there's always a potential for it not to be repaired properly, or for little abnormalities to pop into those genes that can then drive a cell to turn into a malignant cell. And it's the ultraviolet radiation that does it, and it's the ultraviolet radiation in the tanning booth that gives you the tan.
Mm-hmm.
So you're getting the ultraviolet radiation. That's what does it from the sun. That's what does it from a tanning booth, is the UV. Okay, and this is a kind of a misconception. It's hard to shake this sort of cultural sense that we've all grown up with. You know, people who have a nice tan look healthy.
Mm-hmm.
Well, the thing of it is, if you have a tan, you have increased your cancer risk. It's just that simple. If you have a tan, you've increased your cancer risk. That's what a tan means. Tan means increasing your cancer risk, because the only way to get it is by exposure to the UV. So keep that in mind. That doesn't mean people should be afraid of the sun or have nice time outdoors and all that sort of thing. It's good to use sunblock.
Does sunblock, is it effective?
Yes.
Okay. Okay.
Yeah, you got to go for the heavier, depending upon the sun exposure you're going to get, but go for the heavier, 40, that kind of thing.
That's what I have to use now.
The other thing of it is, well, I've been in the sun and I never had a problem, this and that. Well, it doesn't happen for years.
Right, right.
Then it comes home to roost.
Mm-hmm.
So, word to the wise, yes. I mean, people like the way they look, but understand that you are increasing your risk if you use a tanning booth.
Okay, very good. This, I believe, okay, this viewer sent this in, and this was one of the first questions I got several weeks ago, Doc, and in regards taking pain relievers, and this viewer said that apparently she has noticed that she has become constipated from using pain relievers. I wanted to know if that could be directed towards taking the pain relievers. She said once the pain relievers expired and she didn't use them any longer, she was okay.
Well, that's an excellent observation. And this applies to anyone taking pain relievers, particularly people in the acute, post-op period when they take pain relievers. It applies to narcotic pain relievers. It does not apply to Tylenol.
Right.
It does not apply to ibuprofen, Advil, Aleve, Celebrex, Meloxicam, that sort of thing. They don't do this. But a side effect, inevitable side effect of narcotic pain medication is that it slows down the colon. It just does. It's because the colon has, the nerve cells in the colon have receptors for that molecule, for that pain reliever. So it goes to the brain and does its thing and relieves our pain, which is a godsend. If you've got severe pain and you get something that helps you, how much is that worth to you?
Right.
But it also goes to the colon and it puts the brakes on, okay?
Mhm.
Now, there's ways to treat that, there's ways to prevent it, but it is going to happen. There's just, it's physiologic. You know, it's just a natural consequence of it. So there's things that people can do sort of preemptively if they know they're going to be taking that kind of pain medication, or if they get into a jam and their colon's really slowing down. There's things that they can do to counteract that while they're on the pain medication. One thing that you can do is you can take Conneaut, for example. You can take 2 of those twice a day when you start taking your pain
Is
medicine.
that a prescription?
No.
Okay.
No, you can get that over the counter. Milk of magnesia is frequently used, and that is very effective. Milk of magnesia, you know, take a tablespoon or 2 tablespoons. I routinely put in my post-op instructions to patients that they should take basically an ounce of milk of magnesia at nighttime, every night for 4 nights after they have their procedure.
Mm-hmm.
That can prevent this from happening. That can prevent you from getting in trouble in the first place. You might have to up the dose a little bit if you get too slowed down and are playing catch up. You might have to take it twice a day instead of once. Miralax, excellent. Miralax, that's available over the counter in the drugstore. It's a powder. The dose is right on the inside of the cap. It doesn't have any taste. You can put it in any liquid that you want. You can put it in water or fruit juice or what have you. And a dose of that once a day is just as good, if not better, than milk of magnesia in preventing this. And if you go to a dose twice a day or even 3 times a day in severe cases, you know, in the short term, that will relieve this. So those are the things that people can do at home to keep from getting into trouble or get out of trouble. The thing is to realize that this goes along with the pain medicine and plan for it.
It's part of it's going to happen, probably.
It's going to happen. You know, if you have a healthy colon, it's going to happen, because that means your colon works right, and it's going to recognize that pain relief molecule, and it's going to say, okay, you told me to put the brakes on, I'm putting the brakes on.
Never knew that. I had a sidebar question to go with that, Doc.
Sure.
The medical profession has been really come down hard as far as giving out pain relievers.
Oh yeah. It's a big
Very, very
problem.
strict. Very
Big
strict.
problem. Yep.
How long does it take before you become addicted or so-called addicted to pain relievers, and how long after say a surgery should a person be taking them?
That's a very good question. The main thing that I would like to accomplish in answering that question is to allay people's fears about getting addicted.
Mm-hmm.
The amount of pain medicine, I mean, if you have an operation and you're taking Percocets and you take a couple of them every 4 hours or every 6 hours, and you do that for 4 or 5 days, are you going to get addicted? No. No. Nowhere even close.
Mm-hmm.
You're not going to get addicted, okay? You've got to be on a bigger dose, and you've got to be on it long term. Now, is it possible to get addicted to that stuff? Absolutely. Just open the newspaper.
Mm-hmm.
Okay, it's a huge problem, and prescription drug addiction is a huge public health problem in the United States, and there have been some docs who've gotten in trouble, and rightly so in my view, because of you know, basically giving those out improperly. And so the federal government and the state government is very, very tight on this. And there's databases, and I mean, if you write somebody a prescription for that stuff and they've been getting it from somebody else, the pharmacy tracks that, they'll notify you.
Mm-hmm.
They'll say, do you really want to do this? So it's, you know, I mean, it's being watched very, very carefully.
Yeah.
Because it's a huge problem,
Mm-hmm.
okay?
Mm-hmm.
So that's what's behind a lot of times doctors, if somebody comes in and wants narcotic pain medicine, why that sets off a red flag.
So like if somebody has I know an older person that has some problems, I think it's with the knee or something, and wanted to get, I want to say Tylenol 3. I'm not familiar with it. I think it's got codeine in it.
Yep. Yeah.
Doc wouldn't do it.
He wouldn't do it?
No. He said, you've already had it. You had it for a while, so that's time to cut it off. So what do you do after that?
Well, that's a good question. There are pain specialists who can help with that. If it's the sort of thing that really affects your quality of life, and you really need to get some relief, there's other things that can be done, injections that can reduce the inflammation. Anti-inflammatories can be pretty effective. And if it's bad enough, then it has to have a surgical correction.
Sure.
And there is surgical for most joint stuff. There are surgical options that solve the problem. It's a big thing to go through, but it does solve the problem.
Right. Well, that's what you want.
Yeah. You want to solve the problem. But folks, you're not going to get addicted if you're taking pain medicine, narcotic pain medicine, liberally after an operation in a time-defined period to get over the surgical pain. You will not get addicted. So don't be worried about that.
Good tip there. While camping, we have been told that we need to boil creek water. Let's see if I had a cheat here. I don't have my bifocals with me.
Yeah.
If you need to boil creek water, and why would you have to boil that water? Why can't you drink it out of the creek like the cowboys used to do?
Because the environment is very different now than it was when the cowboys were around.
No kidding. That is probably true, but I never thought of that.
Very different. There's not too many wild places where there's no human impact on the water system. Mm-hmm. There's not too many of those places around. Mm-hmm. And even in some of them that are pretty much untouched, there are certain parasites that tend to live in those waters, fish and everything else. Mm-hmm. But most places where people are going to go camping, there has been a human impact on the water supply, on the water system, and there is the potential to get really sick. There's bacteria, there's parasites. Giardia is one that people may have heard about. Okay, coliform bacteria and so on. Those things can make you really sick. All right, even viruses. All right. Now, boiling water to actually boil, and the recommendation is that you bring the water to a rolling boil. Okay.
Okay.
And you let it roll for a minute. Nothing is going to survive that. No pathogen is going to survive.
So then you can drink it
Absolutely.
Safely.
Completely safely.
Okay.
Yep, have no hesitation whatsoever. Now, obviously, boiling isn't going to affect if there are toxins in there, like mineral toxins or pesticides or that kind of thing. We're just talking about bacteria, viruses, parasites, that kind of thing, living things. Mm-hmm. All right, they will not survive that boiling. Okay. And the water is safe once you've done that. But the recommendation is that any water that you get from a source you don't know about, out in the wild or out when you're camping and so on, it really should be boiled if you're going to be safe. And I'll tell you what, if you ever meet somebody who has gotten an illness from drinking the water, you'll understand how valuable that boiling is, because they're sick and they feel bad, and it's a miserable thing to have to go through.
Well, I have a buddy that's camped for years, and many years ago in one of my interviews with him, I think it was back in the radio days, which is way back, his job on his camping trips was to be in charge of boiling water, and I go, what the heck are you boiling that water for? It's crystal clear. He goes, believe me, you don't want to get sick from what's in that water.
That's right.
He says it'll ruin your whole camping trip.
Oh, it will.
You know.
It will.
So that was the first I'd ever heard about it.
Yeah.
Yeah.
You know, and you have, lots of times people will go to foreign countries
Mm-hmm.
and get sick.
Mm-hmm.
That's what we're talking about.
Okay.
That's what we're talking about. And it can look crystal clear. Well, the kind of things that we're talking about are so small. They're microscopically small. You're not going to be able to see them. The water's going to look perfectly clear, and they can be in there.
Okay.
So that's just a tip. You don't want to have to deal with something like this. It's very unpleasant.
Okay. There you go. I'm not a camper, so it's all new to me there, but definitely would boil the water. Do people, should they be home monitoring their blood pressure? Should they have it done professionally?
I am really glad that this question came in, because there's some real misconceptions about blood pressure.
Mm-hmm.
Okay? Well, there's no question that if your blood pressure is too high, if it's too high and it's reliably too high, I mean, if you've got hypertension, it should be treated. We've talked about that on this show a lot, about the things that can happen if your blood pressure stays too high, the terrible consequences that gradually can happen because of that. But here's the thing. You walk into the doctor's office, you walk in from the parking lot, you walk in, you just got in there, you see this busy office, you go in, you sit down, they take your blood pressure. Okay? Is that going to be an accurate blood pressure? No, it's not. Okay? You just walked in, you see the white coats, something bad is going to happen, your blood pressure is going to go up. That is not a reliable baseline blood pressure, but I'm sorry to say that that's how it happens a lot of times.
Mm-hmm.
I have a friend, okay, very good friend, and he's extraordinarily healthy. I mean, he's a guy who really, unbelievable. I mean, he does hardcore cardiovascular exercise 5 days a week. He's not overweight. He's very careful about his diet. I mean, he's like, wow, unbelievably healthy.
Mm-hmm.
Okay, and his blood pressure was taken at rest, okay, where he'd been sitting for 15 minutes and hadn't been doing anything and this and that. And his blood pressure was 120/70.
Wow.
Okay? Which is right where you want it.
Mm-hmm.
Okay? All right. The other day, he went to an optometrist because he needed, some stuff with his eyes, this and that. And he didn't know what they were going to do to his eyes. And he just walked. He walked in from the parking lot. Okay, he walked in. They ushered him right in. He sat down, and they put a band on his wrist and took his blood pressure. Okay, it was like 150/90.
Oh no.
Okay.
Nerves.
All right. Yeah. Physical exertion and nerves and so on. Now, he was quite concerned about that. But here's the thing: if you have high blood pressure, if you have the condition high blood pressure, it is going to be impossible for you to have a blood pressure reading of 120/70.
Mm.
Impossible. That means you don't have high blood pressure.
Mm.
What he had was a normal physiologic and psychological response to the environment that he was in at the time, and look what it did.
Amazing.
Look what it did. And this is happening to millions of people across the country. Okay? You've got to understand how to interpret this.
Mm-hmm.
A baseline blood pressure is when you've been at rest for 10 to 15 minutes, where you're not engaged in a conversation that's getting you hyped up, okay?
Mm-hmm.
But you're just relaxed and quiet for a period of time, then you take your blood pressure. That's your blood pressure. Now, if that's high, there's a problem, okay?
Mm-hmm.
But if it's normal like his, and then you go into a situation like that and it's high, that's physiologic. That means that your body systems are working the way they're supposed to.
I'm surprised that it bothered him that much. I mean, but on the other hand, it's happened to me. I've gone into the doctor feeling great, and that stress or whatever it is takes over, and bingo, it's up there.
There's no question about it. I mean, people have heard this fight or flight. fight or flight.
Mm-hmm.
You know, and what happens when you get into a really stressful situation, really stressful, certain hormones kick in.
Mm-hmm.
Okay, and they're hormones that are made by the body. They're natural. They're produced in the adrenal glands. Okay, and the main fight or flight one is called epinephrine, adrenaline. Oh, the adrenaline rush, epinephrine.
Mm-hmm.
And that does a couple of things. That kicks up your heart rate, it tightens down your arteries, it increases your blood pressure, it gets you ready to either run away or fight,
Mm-hmm.
fight or flight.
Mm-hmm.
Okay? If somebody comes into the emergency room and they're having a heart attack and their blood pressure is crashing, okay, and you got to do some quick interventions to protect their blood pressure, bring it up, and stimulate their heart, what do you give them? Epinephrine. That's what you give people to blast their heart and blast their blood pressure.
Okay.
Okay?
Okay.
It's the same thing that your body's making. Now, you can be in a situation where, let's say, as we see so often in this country, let's say that a couple of family members, you go and visit somebody, and the subject gets around to politics.
Mm.
Okay? And these people really disagree. Like, they really disagree. Okay? This person is very pro-Trump, and this person is very pro-Hillary. And there's a lot of animosity out there. Okay? And they may not feel like they're going to get into a fight, but that epinephrine is kicking in. That epinephrine is kicking in. It doesn't have to be something so much as you notice it, but just emotional reactions that you have. The body's very, very sensitive, and it will start to release those hormones. So that definitely will affect the blood pressure readings, and I want the public to know about this. If you really want to know if you have high blood pressure, you have to get a baseline blood pressure when you've been at rest and where there's no emotional stimulation going on. Then you know what you got.
Mm-hmm.
Okay, and if that reading's normal, then you don't have high blood pressure. Because there's no way, if you have the conditions that cause high blood pressure, and it's truly hypertension,
Mm-hmm.
you can't get a reading that low. It won't go that low.
If you're on medication.
If you're on medication, well, then you expect it to be that low.
Right.
Because
Or
then
you
the
want it to
medication,
be.
you want it to be, because the medication's doing its job. But, I mean, am I making this clear? Matthew, am I making this
Yeah.
clear? I mean, this concept is very, very important.
Mhm.
Because people need to, otherwise people are going to worry.
Right.
See what I mean? And you shouldn't worry unnecessarily. I mean, if your blood pressure truly is high, it should be treated. It's very, very amenable to treatment. It can be brought right back down to the normal range. Very smart thing to do. Protects you long term. No big deal. Okay? But if it isn't high, truly high, that is to say, if you were to have a baseline blood pressure reading under the right conditions and it was normal,
Mhm.
then you don't want to be taking medication.
Mm-hmm.
Do you see?
Mhm.
Okay, so that's very important. Now, as far as the original question about home blood pressure monitors, okay, the way to do that is to get a professional blood pressure reading with the cuff and the, manually under the right conditions. Okay?
Mhm.
And then do your blood pressure monitor at the same time and look at the difference between the readings.
Okay.
Okay?
Mm-hmm.
And if you get it done by the nurse or what have you, and it's 120/70, and then you do your home thing and it's like 124/72,
Mhm.
you can trust your home monitor.
Okay. I never thought of that.
It's good to compare it once, at least once.
Yeah, because somebody told me they have to be, sometimes after it's a long use or whatever, they have to be calibrated or something, and
Well, you can get wear on the hoses, wear on
Right.
the cuff, and that kind of, the little pump motor and so on. So, you check it once and then you might check it again next year.
Okay.
But home blood pressure monitoring is really a smart thing to do. It's a very good
And you
thing
can
to do.
overdo that too, can't you?
Well, sure you can.
I know a guy that would take it every hour, and he was obsessed, and
That's the word.
He'd
That's
have
the word.
one number over here and another number here an hour late. I mean, it was ridiculous, really.
Well, it is. It is. I mean, no, I mean, if you're somebody, for example, if you know that you have hypertension, you know it, and you're on medication, you might want to check it, once a week for a little while, and then maybe once a month. Once you get, good steady readings. But checking it daily, let alone hourly, no, you're just going to drive yourself crazy.
Matt, do we have time for one more or not?
Yeah.
We do?
Yeah,
Okay.
we're good.
Okay. Doc, this is kind of an interesting one that this lady sent me, who's now probably in her 50s or 60s, but she said as a young girl, a friend and herself were sitting on a park bench, I guess here in Conneaut, when lightning apparently struck the bench. Both of them were knocked off of the bench to the ground. And she says, we never sought medical attention and don't believe we even told our parents, probably afraid to. Should we have been checked over at the time, and could such an event cause medical problems as we get older?
Fascinating question.
It's different.
It's different. It's not, getting hit by lightning is not the most common thing.
Right.
And, one of the things, the thing I would have to know about this particular situation is, did they actually have a high current pass through their body? Or did it just hit the bench?
I think it just hit the bench.
If it just hit the bench and the current wasn't transmitted to them, then they're completely safe. Okay? It's just an interesting thing to have happen to you. But there are people who actually get hit by the lightning. Okay? All right. Now, a lot of times it kills you instantly if you get hit by lightning. But it doesn't always, and the answer is yes, it can cause long-term problems. It actually can cause long-term problems. It's a tremendous blast of energy through the body. What's it going to affect? It's going to affect the nervous system and the brain, because those are electrical, basically. Those are electrical. All right? So it can affect them, and it can damage them. It can damage them. There are people, very well documented, who had a lightning episode, and they're okay. They get checked out. Their heart's working okay. They're okay. Looks like everything's okay. And then over the next few weeks, they go through a real personality change.
Really?
Yeah. Well, why? Because certain areas in the brain have been affected by that jolt of current.
No kidding.
Yeah, particularly the frontal lobes. Okay?
Okay.
So you have, this is no joke. I mean, you have somebody, affable person, gets along this and that, and they get hit by lightning, and then within a month, a couple of months afterwards, they're very irritable. They get angry. They fly off the handle. It's like they're a different person. Well, they are a different person because their brain is a different brain.
Does it come back? I mean, go away and they're okay again, or?
No, it can be permanent.
No kidding.
Oh yeah, it can be permanent. Usually, the way that these injuries work, neurologic injuries work, it depends on if the cells have actually been killed. If a nerve cell is killed, it does not regenerate. Not peripherally, not in the brain. Okay? If you get a bad injury to your liver, it's going to regenerate. It's amazing. It's one of the few things that does, but it's amazing how the liver will come back. Okay? Nerves, when they're gone, they're gone.
You're done.
That's it. So that's why strokes are so devastating. Now, sometimes what can happen is when there's a big shock like that, the nerves are injured. They're not killed. They're injured, and they swell and this and that. But that resolves. That gradually resolves. And if the nerves themselves have not been killed, you'll go back to normal. But sometimes the current flow is enough that it kills some of the nerves. And depending on what part of the brain is affected, that's where it'll show up. And if it affects the frontal lobes, which tends to be common, it'll show up in terms of a personality and mood and that kind of thing changing.
Right now is the time, because we're going to be getting some of those storms with this heat, is the time to be careful. Don't stand under trees. I know we lost 4 golfers just across the line here a few years ago, Doc, before you came here, where they got under a tree during a golf match, and they all died.
Holy smokes.
Yeah, it was, so they obviously got,
They got hit, they got blasted.
yeah.
There's other things that can happen. For example, just to finish off this topic, because it's a fascinating topic.
Mm-hmm.
When you get that jolt of electricity, it causes intense muscle contractions.
Mm.
Okay?
Mhm.
I mean, just for that period of time. I mean, you know, if you go to lift your hand, okay, your brain is sending electronic signal through the nerves to the muscles in your arm to go and lift, okay? But if the current gets there to the muscles some other way, like through lightning, it's still going to make those muscles contract. But we're talking about a big jolt of electricity, so it makes those muscles really go into spasm.
Mhm.
A lot of times what will happen, people's neck muscles will go into spasm, and that of course will resolve, and the muscles will go back to normal. But they can put strain on the ligaments and on the discs and so on.
Yeah.
That can be kind of a permanent thing.
Wow.
Yeah, it's amazing, you know. And you know, there's people who you may have heard of RSD. It's it's kind of an esoteric condition, but it's fairly common actually. It's where people get terrible pains in their extremities, and it's from a certain kind of a nerve injury. This gets kind of complicated, but there's different kinds of nerves that go out to the extremities, and if some of those are, you know, sometimes if people have a stab wound or a gunshot wound or something, particularly in the back, they can get that where they've got these pains can be very debilitating. Peripheral nerve problems, lightning can cause that. So it can cause problems in the peripheral nerves by the intense muscle spasms. It can affect the spine. It can affect the brain in terms of personality changes, and perhaps the most common long-term effect of people who've been hit by lightning are chronic intense headaches, which is miserable.
Mm-hmm.
So yes, the answer to the question. Now, this person who's asking this question, I don't know if they were actually hit by lightning, and from what they're describing was a long time ago.
Right.
And if they haven't really noticed anything in the intervening period,
They should be all right.
they're fine. You know, if the question is, okay, well, I got hit and it was 30 years ago and nothing happened, but now could something happen from this point because of that? No.
Okay.
No, nothing's happened.
It would be unrelated.
It would be completely unrelated.
Okay.
Yeah, so
And
that doesn't
I
play.
think we're the way I took it, it was like 40-some years ago, so
Yeah.
I think she's made it.
Oh, yeah, sure. I mean, there's nothing that's going to come on now because of that.
Mm-hmm.
No.
But you still could be knocked out of a bench if you haven't been struck by lightning itself.
Well, yeah.
I guess that's my question.
How would that happen? Well, I knew of a guy who this is an amazing thing. He got blown out of his shoes.
Oh, no.
He literally got blown out of his shoes.
You've heard stories about that.
Yeah. It was wet, of course.
Mhm.
Boom. But the lightning passed right through, and what it did was it boiled the water in his shoes, and the steam blew him right out of
Oh,
his
for
shoes.
goodness sake.
And it happened just like that.
Oh, boy. And
But
didn't kill him?
No, didn't kill. He was like, whoa, what was that? That was cool.
No kidding.
Yeah.
Oh, he leapt out.
But yeah, he got very, very lucky. Freakish.
I wouldn't want that to happen.
No. No.
Unbelievable. Yeah, that is an interesting subject. So just be careful out there. You don't want to get struck by lightning.
No, be careful.
Be careful. Probably should cut it off there, Doc. If we didn't get to all your questions, we will do them in a couple weeks or a month, maybe.
Yeah.
We'll
Yeah, there were a few more on here, and I don't want people to think we're neglecting those. We next, in 2 weeks, we have Dr. Ayapan Menon coming. He's a nephrologist with University Hospital. He's going to talk about some kidney issues. Great guy, and he should have some good information for us. And then the next segment after that, we'll come back and we'll finish these up.
Fair enough, we'll do it.
And if you have any more, please let Pat know, and we'll make sure we cover them.
Email me at nick1@suite224.net, and that's how I've been getting them, and phone calls. We've been getting phone calls too,
Sure.
so
Absolutely.
feel free to give us a ring, and we'll get the questions to Doc Bryant, and he'll answer them for us. Until the next time, have a great summer. We'll see you again.